that's a really good question about the difference between grief and depression, and when is the diagnosis of depression sort of justified or warranted. And surprising no one, I think the answer is it depends. Anytime we're dealing with the human psyche, the human mind, the way that we respond to whatever's going on in our lives, it's always going to be a gray area. I don't care who thinks they have the answer. There is no answer, right? So having said that, though, I think there are some distinct differences. Depression can happen without grief, right? Grief, I mean, to me, grief is part of everything, right? Every diagnosis code is a grief diagnosis, in my opinion. And the difference between grief and depression, and one depression might be warranted, like depression is a little bit more pervasive, right? Like I think about depression as a diagnosis as something that happens without an instigator, in a way. Do you know what I mean? Like if your child dies, if your sister dies, and you start feeling that you don't really fit in the world, the things that you used to have interest in, you're not really interested in, you're not that interested in food anymore, and you're not sleeping very well, those are all diagnostic criteria for depression, but it doesn't mean you're depressed. It means somebody you love died, right? If you are not having that much interest in life, things kind of feel blah and gray, and you're not really sure why, then depression might fit better, right? When you're talking about 2 and 3 and 4 years post incident, I think it gets even murkier, because we have that idea that, grief shouldn't last you more than a year. So if you're still having sort of low affect, which is the clinical way of saying you just kind of feel blah, right? It's still part of normal grief, and you might also start qualifying for that diagnosis, right? I hedge a lot on this stuff for multiple reasons. For me, one of the trickiest things is, why do you need the diagnosis, and how would the diagnosis serve you? If we're really getting into fine-tuning the differences between grief and depression and diagnosis codes, when we're talking about diagnosis codes, really we're talking about what is insurance going to cover and what medications might be appropriate for me, right? Those conversations I think you can have with your provider, with your clinician, with your doctor. I get really stressed out when somebody just had a significant death in their life, and 3 weeks later their doctor's telling them they're depressed. Like, that is just fucking wrong. Yeah. I think one of the reasons that you might be asking, and obviously, correct me if I'm wrong, but like once you are out of the sort of tight orbit of a loss, define that for yourself. But once you're out of sort of the tight orbit, where does it start tipping into depression? So for me, I think the question is, what would having a name for what you're experiencing, how would having a name for this serve you? What would it unlock for you, if anything, right? I think that you can say, tell me why you're considering depression as a diagnosis for me, right? I think you can ask why, like ask them to justify it, maybe not justify your decisions, but I think you can ask them, tell me why you think depression as a diagnosis works here. And that's going to give you a lot of information, because if they come back with, it's been 15 minutes since somebody died and you're still sad, clearly you're depressed, that tells you everything you need to know. If they come back with, well, there's a lot of things going on here and it's really complex. There's trauma, there is grief, there is kind of feeling blah about the world. And I think one of the ways that it might be helpful for us to think about this is through the lens of depression, and it gives me more sessions with you that are likely to be covered by your insurance. That gives you a whole set of information, right? I don't think we can have a blanket, do I trust this person, by what they choose to diagnose. I think that we can gain more information about how much we might trust somebody based on how they respond to the question of, tell me why you think that diagnosis and not something else. Help me understand, right? When you have to show your work as a clinician, like when you have to show your work, you reveal a lot of your thought process. And I think that is something that I wish clinicians would do more is show their work.